Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barela, and today we have an incredibly special program. We're going to talk a little bit about diabetes. And if you don't think it affects you or it's part of your life, watch a little bit at least, because you're going to learn a lot and how it impacts all of us. And our special guest today is Debby Finch, RN, but also a certified diabetic educator from Summit Healthcare. And I would say welcome to you, Debby, to our program here today. It is always good to have a diabetic educator to talk about diabetes, because your experience is so much different from physicians who treat diabetes, because you're more in the trenches than I think us physicians are.
I think we have the opportunity to spend a little bit more time with the people with diabetes than the physicians do.
And I think that that's really important, because I think there's a lot of hand-holding that's necessary to make diabetes treatment successful.
I agree with that. I think a lot of it is helping patients to modify their lifestyle, create action plans. We work very, very diligently with our patients on creating action plans and getting those action plans so that they're very specific, so that they can measure their success in whichever lifestyle change they want to make.
You know, and I just want to impress upon our audience today the significance of diabetes, and I know we have some statistics to talk about it, because it really does impact a lot of people's lives.
I think it impacts everybody, whether we're aware of that or not. Diabetes is only growing. It's only expanding, not only in our country, but also worldwide. November happens to be International Diabetes Awareness Month, not just National Diabetes Awareness Month, but International Diabetes Awareness Month. About 30.3 million people in America have diabetes. That's about 9.4% of our population in total. And up here in the White Mountain area, over 50% of the Native American population have type 2 diabetes. People don't realize it, but type 2 diabetes will be present sometimes in upwards of 5 years before a person is even diagnosed with it. And so there are a lot of people walking around with diabetes right now that aren't even aware of it today at this very moment. In addition to that, there's about 84 million people with pre-diabetes, and those are the people that we really, really want to target with a lot of education to help them to prevent, or at least delay until much later in life, the development of type 2 diabetes.
And that's significant, and those people fall into that 5-year group.
Absolutely. Absolutely.
Those are the people that have diabetes that really don't know it.
Absolutely, yes. And a good portion of them that are, type 2 with diabetes that don't know it are actually at the point of diabetes, in addition to those with prediabetes. And education is so important in preventing the development of type 2 diabetes, and even with those with type 2 diabetes, since diabetes is a chronic progressive disease. That education component and making those lifestyle changes is really important.
Yeah, and another statistic I read somewhere suggested that by the time this 5%, the 5-year period is over and they're finally diagnosed, a significant portion of those people already have early complications of their diabetes.
They do. And so if we can really reach out to those people and get to those people and help them, so that we can prevent or delay those complications that are so associated with diabetes.
So the Native American population has a larger proportion than the general American population, but doesn't age also play a big factor in the presentation for diabetes?
It does. It's not as black and white as it used to be. It used to be that that only children, or if a child developed diabetes, it was type 1 diabetes. But now we're seeing younger and younger people with type 2 diabetes. I've seen children as young as 9 years old with type 2 diabetes.
Wow.
And it used to be believed that if somebody developed diabetes in their 30s or 40s, it was type 2 diabetes. However, we have a small percentage of people that develop type 1 diabetes also in their adult years. So it's not as clearly defined as it used to be, and the term juvenile diabetes is no longer a part of our vocabulary. We have type 1 diabetes and type 2 diabetes.
And a spectrum in between. But what about us old people?
Well, older people,
Thank you.
definitely are predisposed to developing type 2 diabetes, not only if they have a family history of diabetes, because there's definitely a family history link with type 2 diabetes, but think about as you get older, you become less active. Lots of times you're on a limited income. Many of our older population, they're on a limited income, so their resources for food change, their diets change. In this area, we have a large portion of our elderly population receives their meals from on the reservation, for instance, at feeding sites, and some meals are also delivered to people's homes, which is a great service, but lots of times those meals have an abundance of carbohydrates in them.
And we'll talk a little bit about that portion of it, because I notice on the slide that you brought that a significant portion of people with diabetes are overweight.
They are.
85%
are overweight.
85%.
So lifestyle management is extremely important.
Okay, so you were mentioned the two types of diabetes, and so why don't you talk a little bit about type 1 versus type 2 diabetes?
So type 1 diabetes, there is some evidence of a genetic link there with family. It's an autoimmune disorder, however. So
and what does that mean?
the body's immune system basically attacks itself, and there's a destruction of the cells within the pancreas that are responsible for the production of insulin.
So basically, the body is fighting against its own insulin-making mechanism.
It does, and the body needs insulin. We all need insulin in order to survive, because insulin is the key that helps the glucose or the sugar leave the blood and go into the cells to provide the cells with the energy that they need.
And this is predominantly, although youth diagnosis in childhood, before the age of 20, although you did mention some older people?
Generally before the age of 20, but we see a small percentage of people that are diagnosed with type 1 in their 20s, 30s, and even 40s, but definitely generally. And only about 6% of all diabetes is type 1 diabetes. The vast majority of diabetes is going to be your type 2 diabetes.
And I notice you have it all mentioned right here.
So type 2 diabetes, weight is a huge risk factor, or just lifestyle in general. Being sedentary or not as active is a risk factor. And then the food choices that we make is also a huge risk factor.
For weight. And I know we've had your diabetic educator cohort, Becky Moffat, on the show to talk about lifestyle and dietary input, and that will be a topic of one of our shows too. All right, and so
we know that just a 7% reduction in body weight, in overall body weight, is a huge contributing factor to help prevent or delay diabetes, and it also helps the body in those people with type 2 diabetes be more receptive or more responsive to any medications that they may be taking, whether those are oral medications or whether the disease has progressed to the need of insulin.
You know, and that must be attainable, because even on a 200-pound person, that's only a 14-pound weight loss.
7%, yeah.
Wow.
It's pretty significant what that reduction can do. So
Well,
we
that's-
work with people. We definitely work with people on weight loss, and Becky actually even has a weight loss program that she does to help people that are overweight.
Wow.
Yeah, it's exciting what's being done.
It's interesting because, you know, people don't think about the fact that their diet and weight really can make a lot of long-term difference in their lifestyle and their life.
Oh, absolutely, absolutely. Activity is a huge component.
All right, so let's go on. Why should I worry about diabetes?
Well,
Why?
diabetes, believe it or not, is a vascular disease. It affects every blood vessel in the body. Most people, when they think of diabetes and diabetes-related complications, they think of kidney failure, or they think of going blind, or they think of possible amputations of their limbs, especially their lower limbs. But did you know that the number one leading cause of death in people with diabetes is some sort of cardiovascular event?
Yes.
Yes.
That and stroke.
Yes.
That and
yes.
stroke, which are cardiovascular. But I think that's a very good point to think about diabetes as a cardiovascular and a blood circulation disease, rather than what most people think about it as a sugar disease.
Exactly, exactly, because it's going to affect every organ in your body, literally, because your blood feeds your body. I call the blood and the blood vessels the highway of nutrition to the body. And so we want to keep our blood healthy.
I like that analogy, that it's really a blood vessel disease in the heart, kidneys, and especially vasculature. I notice in this, it's because of the vascular complications in the lower extremities, it is the leading cause of amputation.
It is.
Wow.
It is. And that in and of itself, if people are managing their blood glucose values, and they're keeping those values within what we call target zones, and if they're doing daily food inspections, there's a large portion of our diabetes population that don't have foot exams done, that don't inspect their own feet daily, that don't provide that good foot care. And lots of times those complications, those open wounds, those sores that eventually can lead to amputation could be prevented if people were following just some basic, simple
We're going to
principles.
talk about that in a second, because everybody needs a treatment plan. And one of the, I noticed one of the slides you have here is a skin manifestation, because you mentioned that sometimes it's hard to tell whether you're on the road to developing diabetes and pre-diabetes. And what is this slide that you have here?
So acanthosis nigricans, it is this darkening of the skin. It's generally in the skin fold areas, like around the neck or in the creases of the elbows,
Okay.
possibly the armpits, behind the knees. And you'll see this darkening of the skin, and that is definitely an indicator that there's some sort of an insulin resistance, which could lead to, or is currently, pre-diabetes and can lead to type 2 diabetes.
So if you see this, an opportunity to see your doctor.
Definitely want to follow up. Also, if you'll notice in the picture, this person appears to have a couple of skin tags, and excessive skin tags can also be another indicator that you might want to go in and get your blood glucose values checked.
Okay, so now we know that it's a problem. A lot of people have it. Overweight is a problem with it. Sometimes it's very difficult to pick up early, although your sign of acanthosis is there. So if you become a diabetic, how do you take care of it? That's what you do.
That's what we do in the diabetes department. Absolutely, we want to make sure that we kind of accept reality.
Ooh.
Lots of times people are in denial when they're initially diagnosed with diabetes, or they think it's just going to go away, or they think they can fix it. And I try to stress with people that once you're diagnosed with diabetes, you have diabetes. It's time to take action. The longer that a person lives in denial, or a longer that a person thinks that it's just going to go away, the more harm that they're causing themselves from the inside of the body to the outside of the body. So the first thing is going to be accepting that diagnosis and understanding that diabetes doesn't necessarily lead to doom and gloom if it's managed well from the onset and lifestyle changes take place. So I think the first most important thing is to accept and to take ownership of that diabetes diagnosis, and to focus on, from that point forward, living a healthy lifestyle. I think diabetes has this shame and blame stigma associated with it, which saddens me. People don't want to talk about or deal with diabetes because they're embarrassed. And that's one of the worst things that you can do for yourself, is to blame yourself or to feel shameful. It's not necessarily your fault. It's just where we are from this point, and it's time to move forward. So I've seen plenty of people that have asked me, how can somebody can be overweight for so many years and not develop diabetes, yet I've only been overweight for 10 years and now I have diabetes. So we have to remember that there's that family history component. There is that genetic link. And just because somebody else has been able to be overweight and not have an active lifestyle doesn't mean that you're going to be okay if you live your life that way too.
I as a longtime physician, I'm always reminded that anybody can create a family history.
That's very true. Anybody can do that.
Anybody can create a family history. I like your other comment that it doesn't go away. So even if you get better, the best you can end up with is being a pre-diabetic.
Well, here's an analogy that I use.
Okay.
And it helps people kind of visualize what diabetes is. So diabetes is always diabetes. It stays diabetes. Just like if I were to take a cake batter, a cake mix, and I would mix water and eggs in with it and stir it up really good, and it's in this bowl, I have all the components for a cake in my bowl, but is it a cake yet? It's not a cake until you bake it.
Till something happens.
Till something happens and you bake it.
Okay.
And now that I've got this baked cake, can I ever get it back to the batter?
Oh, good
I
point.
can't.
You can't. Okay.
I can mush it up. I can add water to it and make it mushy, but I'm never going to get it back to that batter, ever. So diabetes is kind of the same. Once you have it, you have it. Can you have well-managed diabetes and have your glucose values within those target ranges? You absolutely can, but you always have to be diligent about your lifestyle choices to be able to keep those glucose values in that target range to be healthy.
And that's an important point, and that's part of what you do. All right, so let's talk about the next comment. I kind of interesting, vacation versus retirement.
Diabetes vacation. So a lot of people get really tired. Diabetes is a day in, day out, 24/7 disease that people have to manage, and it can become very burdensome for people. They just get tired of doing it. So I always let people know when they come to our classes or they're meeting with us one-on-one, I always let people know that it's okay to take a diabetes vacation every now and then. If you're having one of those really stressful days, or you're just feeling kind of down in the dumps, if you have what we call diabetes distress, which is a real thing, it's kind of like diabetes burnout, take a vacation. If you're say, I'm tired of poking my fingers, I just don't want to have to do it 6 times a day, or for some people 1 time a day, depending on what your management is. Take a 1-day vacation from checking your blood sugars if you have that opportunity to do it. Now, I do stress if you're on insulin not to take a full day's vacation, but if you don't check once before a meal, that's okay. However, it's really important to make sure that if you take a diabetes vacation, that diabetes vacation doesn't turn into diabetes retirement.
Oh.
Because diabetes retirement, we're now putting ourselves at risk because we're not doing anything that we need to be doing any longer to manage our blood glucose values and to have good management on our diabetes. So it's a well-planned, well thought out, I'm going to take a vacation from my diabetes on this day, this is what I'm going to do, and this is how long I'm going to do it for.
Okay, and in order to take a vacation and not retire, you really need to know your symptoms and what your diabetes is all about.
Absolutely.
You've got to recognize your patterns.
Yes.
And that is your next suggestion here.
So patterns are huge when it comes to glucose management, and if a patient is recognizing their patterns, if they're monitoring their blood sugars, if they're aware of how they feel when their blood sugar is low or how they feel when their blood sugar is high, and they're putting that to the test by getting that true glucose value and doing the finger stick, then they'll be able to work better with their provider to be able to recognize trends. And when I say to recognize trends, I mean you notice that for the past 2 weeks your fasting or your first thing in the morning blood sugar has been steadily increasing, just a little bit. But if you're not checking, if you're not watching constantly, you're not going to know that that's happening. People sometimes think of their glucose meter as a punishment tool because they'll check their blood glucose, they'll look at that number, and whatever that number is, they take it as a definition of who they are.
Oh.
And I like to really reinforce with people, that number is not you. That number is where your blood glucose is at this moment. And if you notice those numbers within those ranges over a period of time, that's just information to help you be aware that a change needs to be made. And so I encourage people to look at those numbers more of a tool or an instrument to help them know, one, which direction their diabetes is going in, and then use those values to help determine what needs to be done about that direction.
And that's an important issue. I mean, even normal glucoses have a range of normal.
Exactly.
So normal diabetes has a range, but if you keep track of it steadily, then don't you have an idea of whether you're going in the right or wrong direction.
And you'll see that trend. It might be very subtle, but you'll notice those values either going up or going down. And we always encourage people, if you notice these trends taking place, that's the time that you really want to hone in and really focus on why is it happening? What have I been doing? Have I changed my food or my eating patterns? Have I changed my activity at all? And if you notice that you've made changes to your food or activity, try to modify that if you can. Now, if it's not modifiable because you've had a life event such as an injury or an illness or a change in income, or maybe your grandkids came to live with you, or you had to go live with your children, and something major has happened in your life where it's no longer modifiable and you're not able to go back to what that previous lifestyle was, that's the time that you take all of this information with you, you go see your provider, and you tell them, this is what I've noticed, this is what's changed in my life, this is what I have tried and it's not working. That might be the time for a change in medication then.
Agreed.
Yeah.
Agreed. Okay. And there's other symptoms you look at other than just plain your sugar, because some lifestyle changes occur. Sleep changes.
Absolutely. Yep.
You may be getting up more at nighttime.
Absolutely. And actually sleep deprivation can cause blood glucose values to increase. Pain can cause blood glucose values to increase, and stress definitely can cause an increase in blood glucose values. Certain medications can also.
Yes, essentially anything that stimulates your body to make adrenaline essentially will, and exercise can also increase your sugar, can it?
It can, yeah, it definitely can.
But stress is a big part of life. Maybe that's why the vacation is such an important
thought
process. Thought process.
A well thought out vacation, right?
And bathroom issues, Well, I just mentioned them about sleeping through the night and
Right,
stuff,
right.
and going to the bathroom more often during the daytime.
That is definitely a sign that your blood glucose values might be going up, for sure. Excessive thirst, excessive bathroom breaks are all signs that your blood glucose values are going up. And if you haven't been monitoring regularly,
Good time to start.
then that's a really good time
So
to
I
start.
want to finish this discussion with your comment at the bottom here about partnering with your health provider, and you're an important health provider for diabetics.
Well, thank you. I love it. I love being an important partner.
And what kind of services do you guys do at Summit? Because I know there are two of you doing diabetes, both on the inpatient and in the outpatient stand, and you have programs.
We do.
So why don't you talk a little bit about those?
So we offer a diabetes self-management training program. It's a series of 5 classes that are 2 hours long, and we do those 5 weeks in a row, generally on the same day, so Tuesdays or Thursdays. And we go through a lot of what we call discovery learning. People have homework assignments we ask them to do to monitor their blood glucose values. We ask them to test in pairs, which is testing before an event and then about 2 hours after an event to see how that activity or that food may have affected your blood glucose values. And we teach people about brief action planning, setting action plans for lifestyle modifications. And all of the skills that we teach in that 10 hours of instruction are skills that people can continue to use throughout their lives to manage their own diabetes when they're noticing those change in trends of blood glucose or they recognize some lifestyle or life event change. We're also starting a diabetes prevention program in January of 2018. It's a year-long program, and people with a diagnosis of prediabetes are eligible to sign up for and become a part of that diabetes prevention program. We do open houses every month also. Twice a month we have a 1-hour block of time that we call an open house for anybody with diabetes to come in and just talk to us about what's going on with their diabetes care and management. And we will sit down and see if we can help them identify trends or troubleshoot any problems that they might be having with their diabetes management.
Cool. How do people get a hold of you?
Well, they can just call us at Summit Healthcare in the Diabetes Department. We have information on the Summit Healthcare website on the internet. There's a little, there's on the lower left-hand corner, there's a diabetes education title that you can click on. Or calling the main hospital line asking for the diabetes department, or calling directly into the diabetes department.
Does insurance cover the program, some of these programs?
Insurance covers most of the programs that we offer. We do have some free programs that we offer, and then we also have a discount application for people with financial needs.
I thank you for all of this wonderful information, and I would tell our audience that if you're in need of services from Summit Healthcare, you now have a connection. I hope that this information has been valuable to all of our viewers, and eat healthy, stay thin, and thank you for watching Discover Health.